The past 20 months have been incredibly challenging for all of us. It is no secret that with the onslaught of the COVID-19 pandemic, both doctors and patients have been hesitant to go back to the hospital for the fear of contracting the virus. Census at our hospital have gone down by almost 50% in 2020, and we knew that if this trend continues, there would be adverse effects to our operations and to our livelihood. While no one could have predicted the impact and the right response for this pandemic, as healthcare workers, we recognize the importance of doing our share in restoring the trust and confidence of people that our clinics and our hospitals are safe spaces for healing. We asked ourselves, in this time of crisis, what can we do to ensure the welfare of our people and the viability of our institution? Then we thought, why not do a health and safety literacy campaign harnessing the exponential power of technology? According to a study done by Google, Filipinos spend an average of 10 hours and 56 minutes per day on the internet. About 73.9 million Filipino internet users make use of Facebook and YouTube to connect and learn new things. Moreover, we ask ourselves, why not take this a step further by connecting with our partners from media so that the good news of health is shared to more people in various platforms in ways that are relevant and responsive to the needs of the Filipino public. These thoughts were the first building blocks that inspired the birth of our WebiCons. But what is a WebiCon? Is it a webinar? Is it a conference? Is it both? The WebiCon is a coined term meant to describe and imbibe the elements of a webinar and a press conference, conceptualized by the Human Resources team of Cardinal Santos with the aim of engaging our community and the general public through advocacy and health education. Together with the medical and marketing teams of the hospital, supported by our partner Grupo Agatep, we responded to the growing and underserved need of the non-medical audience who want to get the right medical information from trusted sources. You may ask, so what now? What did our WebiCons achieve and what outcomes did it help enable? Today, I'm happy to share with all of you our top 3 valuable lessons learned. Lesson 1. The best ideas come from unexpected places. Now, you may be wondering, why in the world would HR people lead a marketing-related initiative? Well, it didn't really start that way. The WebiCon was a passion project born from an advocacy that seeks to empower people with the right information to help them make the right decisions for their health and their well-being. What's more, in times of crisis, everyone is a marketer and a brand advocate. We have to communicate with and engage everyone in ways we have not done before. For us, it was an all-hands-on-deck moment. Doing a WebiCon is similar to how you do a webinar. You choose the topics for the session and invite speakers who are subject matter experts. The WebiCons are free and are conducted via virtual platforms such as Zoom and Facebook live stream. But what makes our WebiCon different is the special participation of our media partners who are there to help us amplify our message to a larger audience through articles and stories published weeks and even months after the airing of our WebiCons. By partnering with the media, we are ensured that our efforts reach more people all over the country and even the world. In choosing our WebiCon topics, we wanted to tell stories of life-saving services that demonstrate our hospital's clinical excellence. These stories are told by our caring Cardinal doctors and made more meaningful by the testimonies of their patients. For our first WebiCons, we chose topics that were relevant to the Filipino health landscape, such as exploring minimally invasive surgeries, which foster faster recovery, lesser downtime, lesser pain, scarring, and chances of infection. We talked about managing cardiovascular diseases, which is one of the top 10 diseases behind Filipino mortality rate. We discussed different methods to alleviate pain and improve mobility. We talked about back pain, considered to be the most common type of pain during this time when more people are working from and staying home, living largely sedentary lifestyles. And finally, just this October, we were one with the entire community in supporting our fight against cancer through awareness and early detection. After selecting the topics and the speakers, we take time to meet with and orient everyone involved so we may share the advocacy of the WebiCon and ensure the best experience for all attendees. We highlight the importance of ensuring that presentations are complete, concise, no more than 15 minutes, and presented TED Talk type, engaging and well-rehearsed. More importantly, we reinforce that the talk should be understandable and relatable to everyone. We coach our speakers on the value of being technically prepared and in ensuring that they represent themselves and their institutions well, even when they are working from home. After all, in our experience, virtual audiences are very particular on appearances, technical seamlessness, and are easily bored and distracted, just like you. They can come and go as they please, and that's something we'd like to minimize as much as possible. The next challenge is marketing and promoting our WebiCons. How do we entice people to sign up for sessions mostly medical-related other than COVID? Part of our WebiCon planning is the preparation of a communication plan which starts with brainstorming for a catchy WebiCon title that will pique the interest of the public. So far, we've come up with catchy and relatable titles such as Why Less is Better, but my all-time favorite is Where Do Broken Hearts Go? A WebiCon on broken heart syndrome and other cardiovascular diseases you didn't know you might have. But I hope that does not give away my age. We release teasers which serve as save-the-date posters too, followed by more detailed ones highlighting subtopics and our roster of speakers. We also send out a series of sound bites and quote cards featuring our speakers to increase the audience's anticipation. While promotions are ongoing in our internal and external platforms, our partner PR agency Grupo Agatep handles the media invites and ensures coverage of the event through digital and tri-media. We come up with possible questions that the audience may have about the topic so that our speakers can prepare and review ahead of time. Simple, right? But taken as a passion project from your organization's best advocates, all great ideas become great initiatives when pursued relentlessly with passion and creativity. Remember, the best ideas come from unexpected places. Support and enable passion projects from all advocates. Lesson 2. Pilot, iterate, repeat. When we were preparing for our first WebiCon, we did not have grand expectations. We started small, working first with allies and like-minded people from the Minimally Invasive Surgery Training Center of the hospital, whose main role is to propagate teaching and learning MIS techniques. The difference was that these sessions were mostly presented to doctors and medical practitioners using complicated medical jargons that would give most of us a nosebleed. This team of surgeons fortunately listened to what we had to say and agreed to try to do things our way for the WebiCons. We measured items like participation, satisfaction, and media mileage. We established reasonable targets so that we are aligned on what good performance looks like. We continued to produce WebiCons featuring the flagship services of our hospital. But more than a year into this pandemic, and with the recent upsurge in COVID-19 cases experienced in March of this year, we thought of using the same platform to initiate meaningful discussions for a community-based, multidisciplinary COVID-19 response and protection program. We wanted this version of our WebiCon to be informed and guided by data and the wisdom of medical, non-medical, and economic frontliners on the ground. It was an aha moment for us, and we wanted to contribute not only to how our community responds to the pandemic, but more importantly, explore common solutions on how we can detect, prevent, and manage infections so that our hospitals will not be overwhelmed. With the direction of our President and CEO, Mr. Raul Pagdanganan, we partnered with Octa Research, a group of academicians who have been studying COVID-19 in the Philippines. Our WebiCon with Octa tackled models and projections that the team uses in monitoring the pandemic. We talked about lessons learned from both successes and failures in pandemic management, as well as practical solutions from different viewpoints. Together with our Chief Medical Officer, Dr. Zenaida Javier Uy, sharing the perspective from the hospital front lines, other stakeholders talked about their experiences and working practices in the community led by San Juan City Mayor Francis Zamora. Mayor Zamora was joined by distinguished business leaders from the private sector like Mr. Jack Nang of the Joy Nostalgia Group and Mr. Yossi Tanco, chairman of the STI Holdings, to name a few. Through this partnership, our WebiCon achieved new milestones. We were able to reach a wider audience, had better media mileage, and recorded twice as many of our target attendees. However, this WebiCon, being a star-studded event, had its own downside. As we had to accommodate all speakers and reactors, we exceeded our runtime, had lesser time allotted for questions, which disappointed some of our media partners. As we were working with mostly external speakers with very busy schedules, we did not have as much opportunity to do extensive run-throughs. We shared the evaluation results with our speakers and discussed and agreed on ways to improve our succeeding runs. Our second WebiCon with Octa, on the other hand, focused on arming the general public with the right information on COVID-19 vaccination and on what each of us can do to increase vaccine confidence towards our shared goal of achieving herd immunity. Considering the evaluation results of our first WebiCon, we ensured that in this session, we have streamlined the discussions and have given ample time for our media to ask questions. This resulted to a higher overall satisfaction rate from our audience, from an average rate of 92.7 to 96.7%. In the same way, our speakers received a higher rating compared to the first, from an average score of 4.3 to 4.6, with a rating of 5 being the highest. We may not have a playbook in pandemic preparedness, but when armed with the right information and knowledge, we have seen that we can make great things possible. These WebiCons served as an avenue for leaders to collaborate and help one another in achieving our common principles of protecting and supporting the health and well-being of people, ensuring continuity of critical services, and serving the broader community. We have gone far since we first broached the idea of the WebiCon. After producing 6, we were able to garner a total of 111 media pickups to date, amounting to over 179 million pesos in value. Our hospital also saw a rise in new patient turnout, recording 64,293 new patients, or 36% of CSMC's total unique individual cases for the period January to September of this year. We were able to mobilize over 155 volunteer nurses and doctors, covering a total of 1,968 volunteer man-hours, helping the city of San Juan to inoculate 173% of its total population, making it the first LGU in the country to achieve herd immunity. Lesson 2 underscores the importance of being aware of your measures of success and what good performance and good outcomes look like. It talks about aligning and driving everyone toward a common goal, doing excellent work that truly makes a difference. So pilot, iterate, and repeat, also known as forming a habit of excellence by learning and making a difference together. We're down to WebiCon lesson number 3. Use storytelling to inspire and motivate others. Allow me to share some success stories. Of 1,489 attendees for the 6 WebiCons, 60% of the attendees come from the healthcare industry, 17% from the academe, and 8% from the media. Patients, senior citizens, and other members of private households tune into our WebiCons, comprising 4% of the total population. And here are just some of the feedback we received from our audience. "98% of our survey respondents have responded favorably when asked if they will consider Cardinal Santos if they or any of their family members would need medical intervention related to the WebiCon topics." Receiving this heartwarming feedback highlights the fruits of our labor as we continue to build a community of learners. We believe that our WebiCon journey, set against this backdrop of uncertainty and complexity, is in itself a great story to tell the world. This is our way of thanking and shining the light on the people who work tirelessly behind the scenes to create great WebiCons that we can all be proud of. Sheila, Hannah, Mikay, Diana, and Krishna, and many others whose names I may not be able to mention here, thank you. Like a gift that keeps on giving, our WebiCon was awarded gold and recognized as a best practice in branding and marketing campaign in the recently concluded Asian Hospital Management Awards 2021. This program is also a finalist for the Social Responsibility Award in the 2021 Investors in People Awards. And hopefully, come January 2022, it will also be the entry that gives Cardinal Santos Medical Center its first Anvil Award. Even as we beam with pride and appreciation for all these accolades, we know that these recognitions were not the end we had in mind when we started the program, but they do serve as confirmation of our continuing efforts to contribute and to make a difference within and outside our hospital. We envision our WebiCon experience to be institutionalized in the many ways by which we educate and communicate with our internal and external stakeholders. We view it as a launching pad for future partnerships and programs of health innovations and of great stories well told. It is our hope that through this WebiCon in a Box session, you would have been inspired and empowered to create your own success stories to learn from and to share with your peers in the industry. Everyone can make a difference, and great ideas can come from unexpected places. These ideas can be relentlessly pursued, supported, and implemented with excellence. And as you continue to do things excellently, always share your story to motivate and inspire others. In times of crisis and chaos, an organization must always steer towards its true north, its vision, its mission, and its core values. Cardinal Santos Medical Center's response for the new normal comes from a place of leadership and service. Our WebiCon serve as great stories our doctors, employees, patients, and partners tell about who we are and what we stand for. I would like to thank the Philippine Hospital Association for recognizing our efforts and for enabling us to share our story. On behalf of our team here at Cardinal Santos, maraming salamat po at mabuhay po kayong lahat.